Happy Recovery Month. Thank you for joining SAMHSA's Office of Recovery webinar series. Today's topic is improving access to prevention, treatment, and recovery support. Our webinar series is to educate and provide key discussions in many recovery spaces. My name is Nicole Balakis, and I have the honor of serving as your moderator today. I'm an external engagement officer with SAMHSA, and as such, I work with our partners to support them having access to our work and resources with the goal of helping them help society. Today's webinar is part of that sharing so we can inform with what works. Please continue to use the chat to drop where you're from. And then we'll use the Q&A when it comes time for questions. With me, I also have Jada Jolly from HRSA, who's providing technical support during this webinar and assisting me. Next slide, please. Throughout Recovery Month, each week, we have been highlighting a theme for the week. This week, our focus is on the recovery dimension of community. We will look at the importance of having caring communities to support the recovery of people with mental health conditions and substance use disorders. Remember, we do not recover alone. The recovery journey can be easier with the support of friends, family, peers, and others in our communities. Creating communities around people in recovery can help ensure that they are socially connected and feel supported through meaningful relationships. There are many community resources, such as support groups, cultural, faith-based, and other social networks that can help support recovery. Throughout this webinar, we will be dropping links in the chat for resources. The first I'll share is a SAMHSA resource to learn more about how to connect to some of these support. We continue celebrating Recovery Month, a national observance held every September to promote awareness of the power of recovery from mental health and substance use conditions. It celebrates the millions of Americans in recovery and recognizes the contributions and accomplishments of people in recovery, their loved ones, and allies. Recovery events are celebrated around the nation and the world. During Recovery Month, we also applaud the dedication of service providers, states, and communities who champion recovery. Recovery Month is intended to counter stigma and instill hope in the American public that recovery is possible. The Office of Recovery is charged with advancing recovery across the nation in partnership with people with lived experience, their families, and communities impacted by mental health and/or substance use conditions. The Recovery Office has sponsored many great events this month. Two major events are our Walk for Recovery, which was celebrated on September 5th, and our Star Awards and the Gallery of Hope art display, which was yesterday, September 24th. Additionally, we developed a toolkit and a variety of fact sheets, which are also on the web, and I'll be dropping some of those links in shortly. We thank you for your attendance today and your support throughout Recovery Month. We honor your commitment to both recovery and others throughout the year. Next slide. Thank you. A few housekeeping items. First, our disclaimer. The views, thoughts, and opinions reflected in this presentation and those of this session, including any handouts or related materials, belong solely to the presenters and do not necessarily reflect the official views, policies, or position of the U.S. federal government, the Department of Health and Human Services, or SAMHSA. Presenters in this session have no financial or other potential conflicts of interest to disclose. Finally, once the session is complete, we hope to have some time for question and answers. I will be monitoring the questions, and please direct any questions you have for the panelists in the Q&A and only talk to each other through the chat. Today, we have a great lineup of individuals to speak prevention, treatment, and recovery supports. Thank you. Our presenters today include Patsy Cunningham. Patsy is a behavioral health advisor at HRSA in the Office of Special Health Initiatives. In this role, Patsy provides advice and guidance to HRSA senior leadership on policy development and coordination for behavioral health issues that impact Health and Human Services, and HRSA. She has over 14 years of experience in the behavioral health field. Previously, Patsy served as a supervisory public health analyst for the Behavioral and Public Health Branch in HRSA's Bureau of Health Workforce. In BHW, she was responsible for developing behavioral and public health policies and programs that improve the health outcomes of underserved populations by increasing access to quality care, balancing the supply of providers, and improving distribution of providers in areas with the highest need. Following Patsy, we will hear from Melina Stout. Melina works with housing authorities, housing operators, and Medicaid agencies to expand and finance recovery support services. Building on management experience as a strategist and innovator in integrated health systems, she helps organizations implement programs and reimbursement strategies that integrate housing into value-based insurance contracts. A dually licensed clinician, her relationship skills and systems approach are especially useful in addressing challenges in rural communities. Also with us, we have Gail Bullard. Dr. Bullard holds a doctorate in health education. Her experience includes nursing practice, both clinical and management, in the areas of maternal child health and adolescent mental health. Healthcare administrative experience. Also, she currently serves as a professor and program coordinator for the Master of Healthcare Administration program at Ferris State University and as project director for the Ferris State University Central Michigan Recovery and Education Network. Again, thank you all for attending. During the Q&A section at the end of the presentation, Jada and I will be monitoring that, and we will also be watching the chat. But please, again, don't put your questions for the Q&A in the chat box. We also will have a short evaluation survey linked in the chat and ask that you all please complete that at the end of your participation. It helps the Office of Recovery and SAMHSA to get feedback from you to ensure our activities add value to the field. I will now turn it over to Patsy Cunningham to bring our presentation. Thank you again for attending.
And thank you so much, Nicole. I'm really delighted to be here today as we recognize Recovery Month, and really excited to share with you, next slide, please. Really excited to share with you what HRSA is doing to really increase access to prevention, treatment, recovery supports. Next slide. Okay, so just as a level set, HRSA, also referenced earlier as the Health Resources and Service Administration, is an operating division of the United States Department of Health and Human Services. We support a broad range of programs to provide health care to people who are geographically isolated, economically, and medically challenged. HRSA programs support equitable health care for those who are in need, serving people with low incomes, people with HIV, pregnant people, children, parents, rural community, transplant patients, and other underserved communities, as well as doing a lot of work in the health workforce systems and facilities that care for these individuals. Through HRSA's more than 90 programs and 3,000 grantees, tens of millions of Americans receive quality, affordable health care and other services. This includes affordable primary care, comprehensive care, including behavioral health, through our HRSA-supported community health centers, as well as through our HRSA scholarships, loan repayment assistance, as well as HRSA-funded prenatal and postnatal care. Next slide, please. So as we talk today about increasing access to prevention, treatment, and recovery supports, I want to really talk about many of the disparities in access that currently exist for individuals trying to seek behavioral health care. So as I mentioned, individuals who are geographically located in certain areas where there are challenges such as transportation, broadband, as well as the number of providers in certain areas have created challenges, especially in rural areas. Also, individual socioeconomic status has prevented some challenges in individuals accessing care if they don't have the type of health insurance that providers are accepting. We've learned more and more that there are several several behavioral health providers who have left the public health system and no longer accepting Medicaid, Medicare, and other marketplace insurance. And so their inability to pay for services has created some disparities in them accessing care. As well as age, we have recognized over the past several years that there has been a shortage in the number of child psychiatrists, as well as individuals who are specialized in being able to provide care for youth, older adults, and other special populations, and really creating limited access in care, as well as race and ethnicity. Oftentimes there has been different challenges in really accessing care, and also the increased need for care for certain populations, including sexual orientation and gender identity. And so I'll talk a great amount about what HRSA is doing to really address those disparities for individuals across all across the lifespan. Next slide, please. Okay, and so this slide is really depicting many of HRSA's behavioral health priorities, which includes integration, workforce, youth behavioral health, maternal mental health, and overdose prevention. We do this work across many of our bureaus and offices, so it's not just located within certain, one particular bureau, and we work collectively to make sure that many of our efforts are able to scale up those other efforts and support them, so we can make sure that there's seamless resources available to all. Next slide, please. So many of you may be familiar with the community health centers, oftentimes affectionately called federally qualified health centers. So HRSA funds nearly 1,400 community health centers and approximately 100 health center program lookalikes, totaling more than 15,500 service delivery sites. And so that means that these 1,400, as well as the 100 health center lookalikes, have an extension of their main site. And so there may be delivery sites at schools, and there may be other delivery sites across the country that individuals will be able to access care. In 2023, our health centers served more than 31 million people. These health centers deliver comprehensive primary health care, including mental health and substance use disorder services, to the nation's underserved individuals and families. And 1 in 3 people living in poverty, and 1 in 5 rural residents. And so they're providing these services to individuals regardless of their ability to pay. In April of 2024, HRSA announced an availability of $240 million for HRSA-funded health centers to increase the number of patients that will be receiving mental health as well as substance use disorder services. It has made awards to approximately 400 health centers in order to make sure that the individuals in those communities are able to access that care. As you heard me mention, many individuals across certain communities have limited access because of whether their social economic status or just workforce shortage issues. And so this is going to do a great part in making sure that individuals are able to access that care. Our health centers and our lookalikes are really instrumental, and they've been on the front line for combating the ongoing opioid crisis by providing medications for individuals with opioid use disorders to nearly 194,000 patients nationwide. In 2022, 52% of health centers provided substance use disorder services to nearly 299,000 patients. Also in 2022, more than 10,000 providers at HRSA-funded health centers were eligible to prescribe MOUD for substance use disorders, an increase of 24% from 2020. And so not sure if many of you saw last year that the data waiver was no longer needed. And so that, really has done a great service at looking at how providers who have DEA requirements and are able to expand the services that are provided for patients with these behavioral health conditions, specifically individuals who are receiving treatment for MOUD. Next slide, please. And so as mentioned, HRSA supported health centers also have service sites. And so a part of expanding service sites is also into school-based services. And so as you can see over the past several years, I'm sorry, I think we have something, I don't know if it's a technical issue in the chat, but over the past several years, HRSA has really expanded resources and services within school-based service sites, including mental health services. And so in fiscal year 2023, HRSA awarded $25 million in school-based service expansion funds to 77 health centers to really increase the number of students and individuals within that community who were able to access mental health services. And it was a requirement for them to provide that level of services. So we know that when individuals are at schools, they're more likely to access that care, especially if there's limited options within their community. So this is really groundbreaking. And for the first time ever, that was a requirement for these extended sites within schools. So we're really looking forward to see what level of impact that has provided for them. And so it's really looking at an integration model within those schools of providing comprehensive care, including mental health. Next slide, please. And so also HRSA really looks at how we can make sure that individuals who are also receiving services for other care has access to behavioral health services as well. Our HIV and AIDS Bureau really have an intersection of behavioral health and make sure they're integrating behavioral health within the work that they're doing. They're making sure that mental health and substance use issues are being addressed to individuals who have a diagnosis of HIV or AIDS, and making sure that the resources and the policies that they develop take that into consideration. We recognize that individuals with chronic care issues may be more likely or more susceptible to depression, anxiety, and other behavioral health concerns. And so we are looking at ways to continuously improve access through integrating behavioral health within the care that is provided to patients receiving HIV and AIDS care, and making sure that behavioral health issues in people with HIV can act, we recognize that it can act as a barrier to care as well. So vice versa, even when an individual have a behavioral health condition, sometimes it can create challenges with them being compliant with treatment recommendations, treatment compliance. And so making sure that they're not addressing just one of their needs, but people come to you as whole persons. And so making sure that their needs are addressed concurrently. Next slide, please. And so, as I mentioned, youth behavioral health is also a behavioral health priority here at HRSA. Our pediatric mental health care access program really promotes health integration in pediatric primary care. These programs are teleconsultation programs at the state level, and they really work to assist pediatric providers now beyond primary care, but also in the emergency departments and now in schools, to really be able to have real-time access to technical assistance, training, help them with diagnosing and treating patients who are within their care. The Bipartisan Safer Communities Act really helped to expand those services within emergency departments as well as schools in fiscal year 2022, as this program received an additional $80 million over a 4-year time period. Next slide, please. And so many of you may be familiar with the National Service Corps program, which is a program that offers both scholarship as well as loan repayment to individuals who are providing care in certain areas, including medically underserved urban communities, rural and tribal areas. But more specifically, looking at the work that it's doing to really increase access to behavioral health care, there was a total of 651 million people who received support for scholarships and loan repayment in order to increase access to primary care, which also includes behavioral health. And so just recognizing the impact that this program makes, over 18,000 National Service Corps providers giving care to over 19 million people. And so more than 47% of National Service Corps members currently provide behavioral health care services. And so that's a tremendous impact that is making on the community to make sure that individuals have the care that they need when they need to access it in the highest need areas. Next slide, please. Another program that is a little bit newer to loan repayment is the Substance Use Disorder Treatment and Recovery Repayment Program, Loan Repayment Program, which really focus investments specifically on individuals or providers who are providing substance use disorder treatment services. And so this includes an array of professionals as well as health support workers. And so individuals who are working in these areas have an opportunity to receive loan repayment resources for up to 6 years, and they're required to work in certain areas. And so I do believe that we have a link for that resource that individuals can access to really see how they can receive some loan repayment assistance, but also being able to serve in communities that has that high need. Next slide, please. And so the next couple of slides are really going to look at some workforce development opportunities and workforce support that allows providers not only to get training didactically, so within the classroom setting, but also to get real-time clinical experience working with patients in community-based sites that have a partnership with our grantees. And so our Behavioral Health Workforce Education and Training Program, which is one of the flagship programs in our Bureau of Health Workforce, really looks at how it can address workforce shortages by increasing the supply of both behavioral health professionals. So those are individuals identified as master's level and doctorate level students. So social workers, professional counselors, marriage and family therapists, as well as paraprofessionals. So individuals who are trying to obtain a certificate as a behavioral health aide, a community health worker, a peer support specialist, and other training tracks. And so looking at how do we train individuals in areas to retain them. And so these grantees are required to establish relationships with community health centers. They're required to establish relationships with community-based organizations that are providing care in rural areas or areas that have a high professional shortage area, or what we affectionately call as HRSAs. We've made investments of approximately $67 million to 168 organizations for the BWEP professional program, and a little over $16 million for 44 organizations for the BWEP paraprofessional programs in academic years 2022 to 2023. And so grantees have trained over 6,000 students, and over 4,460 students graduated and entered into the behavioral health workforce. And so we really look at this program to help really reduce the workforce shortage issues, but we know that continued funding is needed to make sure that these programs continue to make strides to do just that. Next slide, please. And another program that we support to really help professionals who are in the field really look at how can we screen, in addition to treating patients who have maternal mental health as well as substance use disorders. And so 13 states are currently implementing this program, and they look at ways to expand healthcare through screening, access, treatment for pregnant and postpartum people. We recognize that there are really high rates of mortality and morbidity for individuals who are for pregnant people. And so there was recently a maternal mental health strategy that was launched a couple months ago. And so this program really supports that initiative that HHS and the White House have to really reduce the number of mortalities and morbidities by looking to see how we can support the behavioral health needs of these individuals. Next slide, please. And our National Maternal Mental Health Hotline, it actually had its anniversary on Mother's Day. It was launched Mother's Day in May of 2022. And so for you all who don't know, the number is listed right here on the screen, but we also have a link that you all can share, 1-833-TLC-MAMA. This resource is really vital because it is a 24/7 free confidential support from professional counselors before, during, and after pregnancy. And not only is it available to the individual, but it's also available to their families. We recognize that people they receive support from their family members, whether it's their spouse, whether it's their children, whether it's their parents. People don't live in isolation. And as Nicole mentioned earlier, people recover together. And so making sure that resources are available to the community of the individuals who are seeking the services is vital. And so this is a very resourceful funding opportunity that was really, intended to make sure that everyone has access to it. I believe you can maybe scan the QR code and pull up some information. There's free literature that the site actually offers as well if you want to share within your communities, but also this resource is able to reach Spanish-speaking pregnant and postpartum help seekers. They created Spanish versions of the promotion materials, including newsletters, website content, posters, social media graphics, wallet cards, flyers, etc. And so please make sure you check out that resource. And I'm coming up on my last slide. I think I mentioned earlier, HRSA really looks at ways that we can make sure that individuals in rural as well as underserved communities have access to care, recognizing that rural communities have unique needs. Our agency was able to fund the Rural Community Opioid Response Program initially in 2018 to really address and respond to the opioid crisis, but it really expanded beyond just opioid overdose and really looked at how do we also support youth? How do we also support individuals who have psychostimulant disorders? How do we also support individuals who are, who may have had a dependence on substances when they were born, so neonatal abstinence program. So there has really been extensive expansion of this program over the past several years, but the program really provides direct funding and technical assistance to rural communities to improve access to behavioral health care. And through many of the initiatives, more than 4 million individuals living in more than 1,900 rural counties across 47 states and 2 territories have been able to access substance use treatment, prevention and recovery services that otherwise would not have. Our programs, our grantees that were funded were able to create new access points, was able to provide technical assistance, was able to create collaborative opportunities to see what best practices can be utilized to address the unique needs of individuals living in rural communities, create publications, and really do some great work in this space. In fiscal year 2023, the Rural Community Opioid Response Program awarded more than $80 million in awards to rural communities in 39 states to support many of these key strategies to really respond to overdose risks, including fentanyl and other opioids. And I have the fortunate pleasure of being able to co-present with individuals from our Rural Community Opioid Response grantees. And I would now like to turn the floor over to Melina Stott as well as Dr. Gail Bullard. The floor is yours.
All right, thank you, Patsy, for all of the rich information. Next slide, please. So one of my roles is as an outreach and engagement specialist, and I work with the Fletcher Group. We are a rural center of excellence funded through the Rural Opioid Initiative that Patsy just mentioned. We've also kind of heard a little bit about some of the rural challenges, as well as the breadth of programs and funding that HRSA has to promote addressing those challenges or shortages or isolation. So one of my roles is actually to complement a lot of that work. In addition to helping individuals address those rural challenges, such as workforce shortages, economy of scale, isolation, or even the not in my backyard, NIMBY, we call it, kind of attitude around some of the services that promote recovery for our communities. So the Fletcher Group Rural Center of Excellence, we are a community catalyst. One of our roles is to engage individuals, organizations, and communities using a boots on the ground approach. We do that by participating in community events, providing community trainings, doing outreach, this kind of snowball effect of you attend one community event and they introduce you to somebody else. So a lot of the work that we do is engaging and assessing what's going on in these rural communities and how can we help. We then help these communities and providers by driving best practice and innovation. So we sit with them to look at funding resources or programs that are available both in their community or through HRSA or SAMHSA. We help them implement once they've received funding for these programs. We have a research team that provides evaluation support or even provides research in the process of deciding what are the best practices to implement. And then we also disseminate those best practices. So we've got a portfolio of toolkits and webinars and presentations where we are able to support people's ideas about what they want. Everything is unique to that community because that community is unique. And so one of the things that we do is we really help develop those conversations and sit at the table with folks and contemplate the challenges. When we hear some of that, you know, we are also working with individuals on the training and technical assistance that is available. And in some cases, we're providing that to the health system. And in other cases, we're providing that to the systems that support the health-related social needs that individuals have, such as recovery housing or recovery support services. And of course, last but not least, we do research on this work in trying to really understand, you know, implementation and best practices and what really drives the success of recovery programs and individuals in recovery. Next slide, please. Some of the areas where we provide implementation and technical assistance support really is around evaluating your community's needs, right? In order to provide the services or the supports that individuals need to thrive, we need to look at what's going on in the community and how our programs and the people that wrap around those programs supporting individuals. Using that knowledge, we engage stakeholders and begin to develop project plans that help them outline and plan for their success. We use the recovery housing model and the peer support model and consider community-based care as ways of how do we align the social and medical components of interventions that lead to recovery. And of course, then we're looking at blended funding. How do we pull this funding in together from local, state, or federal resources that help us create those holistic models that really promote a healthy community and recovery? We also have subject matter knowledge in terms of opioid response programs and criminal diversion programs, which often happen to be an important complement in helping divert people from jails successfully into the community. And then we also work with individuals on promoting workforce initiatives once they are in housing to support people obtaining work and recovery when they exit housing. Next slide, please. So what is a recovery ecosystem? I really like this visual here because it kind of describes a lot of our work. We are often planting seeds that grow. It takes time to build relationships in the community and have the conversations and create the coordinated services that help people respond so that they aren't working in silos. And so recovery ecosystem is really a way of talking about the factors that support programs or individuals in achieving recovery. We know that people don't exist in isolation of their environments and that their environments can pose barriers, but they can also be protective factors in helping individuals' recovery. So what is in a recovery ecosystem? Recovery ecosystems, our vision is really that they're bringing communities together from different parts of the system to have critical conversations about the impacts of collaboration on the outcomes or the overall health of the community. And so in many communities, we're bringing local and state officials together to look at state level resources. We know that people come into contact with the rural health centers or community health centers that are supported under HRSA. And so we're working with those systems and those medical providers. We're also working with behavioral health organizations that receive funding from SAMHSA and state agencies and Medicaid. And then we're also bringing in the community-based organizations addressing health-related social needs or social determinants of health. Faith-based communities, as well as public safety and first response, are often involved in, the discussion of implementing these programs and leveraging the supports that are available to individuals. Transportation and housing, as well as work, employment, are big conversations that we have around creating the circumstances that allow people to achieve their recovery. We engage with educational institutions, and you'll hear a little bit from one of our partners about that. All right, next slide, please. So how does the recovery ecosystem create recovery capital? Well, the idea really is that people are coming in from the community into this recovery ecosystem where housing is a foundation for those individuals, because it establishes a sense of safety, a sense of community, a sense of connection, really uses the components of the social model in terms of their relationship to health outcomes. And really that when you're providing those both social and health services and attending to people's needs, they're able to focus on their recovery goals, leading to employment, which is often a prerequisite for housing. And then, of course, the social support and the transportation that allows them to navigate their daily lives in the community also become very important. All right, next slide, please. So how do you understand your community's recovery ecosystem? So one of the tools that we have available that we developed in partnership with the University of Chicago and East Tennessee State University is this recovery ecosystem map. When you access this map, you're able to go to each county across the United States and really kind of understand the measures of what's available within that community to promote recovery. And if we go to the next slide, I can go a little bit into some of the elements that are considered. So these are basically indicators of success within a recovery ecosystem. Basically, in order for people to be able to start their recovery, we're looking at access to SUD treatment. What is the availability of facilities, medication-assisted treatment, mental health providers within that area? What is the density compared to the need? After they get stabilized through the medical system, what does the continuum of support look like for individuals across the system? Are there supportive programs, including policies that promote keeping people in the community once they've established their recovery goals? And then last but not least, the social infrastructure that's in place, access to transportation, housing cost burden. We know that people can't remain in housing because of cost, and that impacts their health outcomes. Broadband access in terms of access to telehealth. And then, who's engaging in the community to promote recovery outcomes. So using that information, we engage in a conversation with communities about beginning to map their assets and how they can pool those together to create the recovery programs and achieve the vision that they want to see for their community. All right, next slide. All right, now I actually have the pleasure of introducing Gail, who's also an ARCOR recipient. We have worked with Gail and Ferris State University. We met at a HRSA convening. And they really are embracing this idea of the recovery ecosystem model. So our initial work with them actually began around developing recovery housing. There was limited access to recovery housing in their network. And so we've worked with 3 different organizations, 2 in establishing new recovery housing and 1 in implementing programs in recovery housing. We also have an employment coaching project happening with one of the homes where they're training individuals to provide that employment coaching and employment support services in the community. We've recently engaged the Medicaid partner into the conversation as we talk about aligning health-related social needs and the social and medical model into the community. We've also had a lot of conversation around the health and housing continuum of care and what sort of housing is available to support the various stages of recovery that individuals are in, such as permanent supportive housing, recovery housing, and other transitional support programs. And then last but not least, and this is where Gail will be able to share her expertise and her boots on the ground work, We've really supported the stakeholder partnership and convening. We have ongoing regular conversations to plan and strategize on ways to bring the community into the work. And with that, I'll turn it over to Gail, who can share with you in detail about her wonderful work.
Thank you, Melina. The Central Michigan Recovery and Education Network, we call it CMRON, is a grassroots network coalition built on collaboration and community that is managed by Ferris State University in Big Rapids, Michigan. We serve as a community connector to enhance collaboration in what is now a 5-county region. We started in 2016 as 2 deans at Ferris State wondered how the opioid crisis was impacting Ferris State, and they quickly realized the need to reach out to the local hospital, the community mental health and health department, and thus began the Rural Health Task Force. In 2019, they received a HRSA RCAR Planning Award focused on Mecosta and Osceola counties. Working with often 30 people in a meeting, we had some very siloed folks at the table who would barely share what they were doing or discuss what the needs were. Some thought there were no gaps. We continued to write the strategic plan in a manner that would help us build a collaborative coalition working through those who wanted to be engaged. We were awarded the HRSA RCAR implementation grant in 2020, and starting with some of the same partners we had in the planning grant, we did just that. It was COVID. We started slowly with those who could spare the staff hours, and all meetings were virtual. By 2022, folks were on board. Siloed walls were starting to crack, and we began to make some progress. In 2021, we were awarded a Michigan Health Endowment grant, which allowed us to partner with the area federally qualified health center to start a pharmacist consultation program for persons receiving MAT. In 2023, we were awarded the HRSA for RHND funding to develop a regional recovery ecosystem in 4 counties and have since expanded at the request of our partners to 5 counties. Next slide, please. When CMRON began in 2016, Narcan was not a consideration in our area. By 2020, some partners were attempting to distribute this through the public. And when they would pick them up in the little black first aid kit and realize there was Narcan in it, we were told that the community would just literally drop it on the table. They wanted nothing to do with that. Through collaborative education efforts across the county, between 2022 and 2023, it was much different. CMRON alone distributed 2,900 boxes with partners distributing much more. Fast forward to today, CMRON is being reached out to provide training in Narcan in many parts of our region. A public health graduate student did her capstone project in 2021 on how the region would respond to at-home drug disposal. And she found that it was very positive. About 83% of her respondents wanted to learn more. So as the word spread, we were able to distribute 4,000 pouches. As with Narcan, we continue today to be asked to distribute the pouches in the training. In 2022, we were awarded that Michigan Health Endowment grant with the FQHC, and it was for a clinical pharmacy telehealth program. We had a very small N in the study program, and it involved a pharmacist survey of MAT patients' social determinants of health, and then they were referred to resources as needed. In that work, they discovered one person who'd been in their practice for a long time who claimed she had been homeless for 5 years. No one had ever asked the question, so no one knew. Others had transportation needs, etc. Through that program, they were able to help those folks. The program included the development of a rural health pharmacy residency program between the health center and Ferris State to help with pharmacy staffing, which is now fully accredited and sustainable. The program itself with modifications continues today in the Health Center for Substance Use Disorder and other chronic diseases. For about 18 months, we met monthly with the local healthcare system regarding the need for increased MAT and resulting in an addiction center expansion to put them in one county for us. And now in our 5-county region, we have those addiction centers in 4 of the 5 counties. At the same time, other partners, such as the community mental health, added same-day assessment and access, including the addition of early recovery relapse groups that filled within the first 3 weeks. So they expanded those groups. Today, we have startup recovery meetings such as Celebrate Recovery and Freedom That Last groups, which have 30+ attendees each week, as well as weekly Sober Social Friday events with food and education and fun that have as many as 70+ attendees in one county. We've been able to start a Face Addiction Now chapter, Face Addiction, formerly known as Families Against Narcotics. We have them in 4 of our 5 counties, and we're working currently to get it in the 5th county. These include Hope Not Handcuffs programs. 3 partners are planning recovery home startups or expansion, with 2 of them working with the Fletcher Group for mentoring and guidance. And we also hosted in 2023 a SAMHSA Talk They Hear You campaign. And we had over 2 million billboard impressions and 30,000 listeners in that time period for our radio PSAs. Currently, we are in Recovery Month here in September, running more PSAs from that Talk They Hear You campaign. Next slide. Thank you. A person-centered model, we strive to have a space for all who want to be engaged with ChemRun, knowing it takes everyone working collaboratively to meet those with substance use disorder where they are, to support and lift them to their desired level of recovery and well-being. Other partnerships, such as those with Fletcher Group, have been very beneficial. In 2022, when a new partner proposed a much-needed recovery house for men, we reached out to Fletcher Group. Dr. Johnson left our partner speechless and in tears after explaining that what he could do to assist them would be provided at no cost. The partner had expected it to be unaffordable, thus making their dream unattainable. Today, we continue to partner with Fletcher Group as they provide guidance in the challenges we face and provide thought-provoking questions for us to ponder what we might do to build a collaborative, sustainable recovery ecosystem. Communication is essential. As you can see, all the different layers within our networks, we have to stay connected. Beyond our monthly meetings, we have a monthly newsletter, a website. We host community conversation days every 6 months that touch people across the 5-county region. We support partner community events, and we meet with individual partners whenever and as often as needed. Next slide, please. Why collaboration has helped. You can see all the ways on the slide that we collaborate, but I can't find better words than those from one of our partners. Her words: I've been out here in the far corner of my county working hard, doing my thing to help the homeless and those with substance use disorder. It's just me and 2 employees, and we do it because we have a passion to help these folks. I joined ChemRun, and wow, I found so many who are helping in ways I had no idea. I've collaborated with partners to get increased funding awards. I've started working with Fletcher Group. In 1 year, we are so much more than what we were. Next slide, please. So where's ChemRun going next? We're working on that recovery ecosystem. It requires system change. We're moving across 5 counties, but people are open. In one county, we've gone from people protesting in the streets over where a Narcan distribution bus was going to be placed about 4 years ago, to having all of our counties now starting to refer and reach out to us for help. Different groups, schools, agencies are being referred to us to be a part of the change. It's exciting. We're hearing from so many, excuse me, who are willing to tell their stories, tell of their hurt, tell of how stigma has impacted them and stopped them from receiving treatment. Slowly, the silo walls are starting to crumble, and there is a crack in the light working through this veil of darkness. Thank you.
Thank you to our presenters for the fabulous information that all three of them have been able to share with us. I do have a link in the chat for a post survey, but first let's get to some of the question and answers and see if we can do those, if the panelists want to help with these. One question is there a cost to engage the Fletcher Group in assisting in creating an RCO?
So the answer to that is, if you are in a rural community, we are able to provide you technical assistance and guidance under our grant with HRSA. For non-rural communities, we can provide a one-time TA assistance support where we can guide you in the direction of the right resources.
Thank you, Melina. And I'll also share that on SAMHSA's website, there is practitioner training, and there are multiple TA centers within SAMHSA also that we didn't cover in today's webinar, but the technical assistance is available for folks, and there are not costs. One thing with that also, they do a lot of training webinars and things in the TA centers where they're recorded, and you can go back and watch those if you're not able to join live. So I do want to share that for folks also. Anything else that the other panelists have to add to that question?
I'll just add that I put the TA request link in the chat.
Thank you, Melina.
Mm-hmm.
Someone also asked about recovery getting less focused than treatment and preventions, and where to get resources if they are mostly virtual and using public space for meetings, that they're having difficulty getting funding. Do you have any input to provide to them?
Sure. So we've worked with a few rural communities and their recovery organizations. Related to funding, a lot of healthcare funding is tied to Medicaid reimbursable services. So when we start to do recovery related work, we're often looking in the direction of grants. SAMHSA does have a lot of grants, and so does HRSA around, creating these conversations in communities. And so we are happy to engage in a conversation based on your community. Being virtual is okay. Oftentimes recovery organizations are grassroots organizations. It's one of the things that we love about working with recovery organizations is the passion, the urgency, the way that you're able to engage community support. That's starting to plant the seed for the changes that we want to see in your communities and the conversations that we want to have. So a lot of our role is to really help you research that funding and help create the language that you need to be able to move your agenda forward.
Right. And if I may add, I think, Nicole, you may have dropped the links to the STAR LRP, as well as some of the workforce programs that individuals are eligible for. So I do recommend that you check those links out. If there's any specific workforce needs that recovery organizations need, just check and see if staff may be eligible for that level of support. So sometimes it may not be it may not be information that you all know already. And so I would just, recommend that you check it out and see if there's anything that you're eligible for.
And you can also go to the websites of those agencies. For instance, SAMHSA, you can subscribe for NOFO announcements. And that way, when notices of funding are released, you get those and don't have to go out and find those. Those will come directly to you. So that is certainly helpful. And then, as the others have said, oftentimes private grants, something through your state, there are other resources where these recovery services are allowable expenses. Okay, there is a question, if somebody can possibly get the link to drop in the chat for naloxone availability maps where somebody can find distribution. I'm not sure of the one-stop place for that, but I know that you can just do a Google search typically and find where those are. That is a question. And we will look to send out a PDF of this after the fact. Remember that I dropped the link previously for folks to go in and provide feedback on this webinar. And I do want to thank our panelists for their knowledge today and their wonderful sharing of what the work that they do to make a difference in their communities. And thank you all for taking the time to join us today also for this webinar that was focused on our recovery communities. We know that your time is valuable and we appreciate you spending an hour here with us. If there aren't any other direct questions, oh, thank you so much for that naloxone resource. Mandy just dropped that in the chat. Thank you, Mandy. So that is in the chat. Are there any other outstanding questions? Any last minute remarks from our panelists?
I think there was a question about receiving support. So I think our Find a Health Center link was also noted within the chat earlier. So if there are individuals in need of prevention, treatment, or recovery supports, and you know of them or individuals that's connected to your organization, please feel free to share that Find a Health Center link, and individuals can access care there as well. So just wanted to kind of reemphasize that.
Thank you, Patsy.
You're welcome.
Melina, Gail, Dr. Bullard, anything else to add?
For me, just please reach out through our TA portal if you're a rural community in need of assistance, or if you're anyone and has a question that we can provide a response to. Thank you for being here today.
And from me, if anyone wants to reach out and talk to us and learn how we did what we did, please do so. And I can put my email in the chat for you. Thank you.
Thank you so much. So Dr. Bullard will put her email in the chat. Melina can be reached via the Fletcher group through that TA center that we put the drop in the chat. And again, thank you so much for your time and your commitment to the community of recovery. And have a great afternoon, everybody. Thank you.
Thank you.